Welcome to week 4 of Gero 205. This week I'm going to be talking specifically about the senior continuum. And what I mean by that are the different senior living options available. Maybe you've all heard of nursing homes, assisted livings. What are the differences? How are they paid for? These are some of the things we're going to talk about today. Some of these facilities or types of facilities you may not be familiar with, so we'll try to kind of get to the down and dirty of what they are. So to start off, we're going to talk about what's called independent living. And I'm going to break these all down. We're going to talk about independent living, assisted living, skilled nursing, rehab, and inpatient hospice. And kind of explain what I mean by a continuum of care facility, which would be all of these options on one campus. Now, an independent living facility, I kind of just call them the apartment buildings for seniors because that's essentially what they are. They are private, excuse me. That's better. They are privately owned apartment complex buildings designed specifically for seniors. And that's pretty much the only way to describe all of them, and that's pretty vague. I've seen communities that say, apartments for people 55 and better, 55 and older, however they phrase it. Some of them are for people age 65 and older. There's all kinds of different amenities. For example, some allow pets, some may have a senior-friendly workout room, some may have a pool, just like any other apartment building on the market. And they are, they're private pay, just like any other building. You would pay for the rent out of your own assets. And the price really just depends on the real estate market. If you're looking to get a 3-bedroom apartment, lakeside prime real estate, it's probably going to cost you pretty penny, maybe $6,000 to $8,000 a month, just off the top of my head, some of the numbers I've seen. Whereas if you're going for like a smaller apartment with fewer amenities, maybe in a suburb or somewhere in a rural area, you're probably looking at, maybe $600 a month for rent. It's just all over the board. And these senior apartments, some of them are, they go above and beyond. Some of them have an activities coordinator that coordinates outings and fun things for the residents to do. Some of them have special resident activity rooms or areas, things like community kitchens or even like auditoriums for people. Some of them are pretty nice, and others are just plain old run-of-the-mill apartment buildings. So when looking at independent livings, people really have to be wise consumers. Think about, is this a place where I want to downsize to? Can I have my grandkids here? Some places have visitor restrictions, so they don't allow children past certain hours at night. I had one lady move into a different community because hers didn't allow children past 8 p.m. and her grandkids couldn't spend the night. Something to look at before you move into one of these communities. Some of them have things like pharmacy delivery or food delivery available for seniors because they're designed to help seniors stay there. Some of them you can make modifications to. You can add things like grab bars or modify the tubs so that they're less of a fall hazard. Just all kinds of things. They run the whole gamut. And these are not to be confused with low-income subsidy housing for seniors. Low-income subsidy housing for seniors. This is an option for seniors who don't have a whole lot of money or income. So they're apartment buildings that people pay rent based on what their income is. These are not the same as independent facilities because these are what are called income-based. So if a person has, maybe they only get $2,000 a month in Social Security. For some folks, that's actually pretty high. Maybe they only have to pay 25% of that as their rent. That would be subsidized senior housing, whereas an independent living community is a set rent price, a private apartment, private, just like any other apartment building, just designed for seniors. So that being said, let's look at some of the other communities. I'll kind of go from least amount of intervention to most. So the next step from an independent living, and a lot of folks too, they want to age in place or age where they are. So a lot of modifications such as like the grab bars, like I was saying, or modifications to stairs, those are sometimes very easy to do in independent living because The apartment manager or the property manager wants people to be able to stay there as long as possible. That's everyone's goal. So sometimes they'll bring in, for example, home care, which is private home caregivers, like companies like Home Instead Senior Care or Comfort Keepers are popular kind of in around the nation. I used to work for Home Instead Senior Care, so they'll always kind of be my favorite, my first choice. But anyway, these are companies that you have to hire privately, so you have to pay out of pocket for their services. Medicare and insurance doesn't typically cover these services, but they can come in and assist with things like laundry or meals or just kind of the whole gamut, housekeeping, transportation. And those are a way that some seniors are able to stay in independent living a long time. And also available sometimes are things like senior taxi services, Meals on Wheels, all kinds of ways to help seniors stay. Independent livings are popular just because they're easy to downsize to. Sometimes people just don't want to deal with like a big lawn or a bunch of empty rooms, so they just choose to downsize to a senior apartment. They're easier to maintain, especially for seniors who have mobility concerns. And they're usually pretty convenient locations. Maybe these people just want to be closer to their children or grandchildren. But anyway, moving into that next step, so you have independent senior living, maybe with some outside private help coming in. If that's not enough, maybe the person is a fall risk, maybe they've got memory care issues, then typically the next level of care is what's called assisted living. And assisted living is, you're going to break it down by two things. Basically, you're going to look at ADLs and IADLs. So ADLs are the activities of daily living. These are things like dressing, bathing, grooming, eating. They're the things one needs to do to keep one's body healthy. And then you have what are called independent activities of daily living, or IADLs, things like balancing a checkbook or going to the grocery store. You don't need to do them for the sake of your body, but you need to do them for the sake of your independence. So typically in an assisted living facility, you will see a lot of help with IADLs and some help with ADLs. That's where we get into things like a CBRF, which basically categorizes a person's level of care based on their need. And CBRFs have a license to provide certain tiers of care. All right, sorry for the delay. So where were we? ADLs and IADLs. The ADLs are going to be, like we talked about, grooming, feeding, bathing. The IADLs, or independent activities of daily living, are things like making a grocery list or balancing a checkbook, managing finances and bank accounts. Those types of tasks qualify as IADLs. So they're not the things that are necessary to take care of your body per se, but they're things that are necessary to take care of you and your affairs. So in an assisted living facility, you typically see a lot of assistance with IADLs and moderate assistance with ADLs. And that's the model that it's been for a long time. Now, here in Wisconsin especially, they're popular. They're what's called CBRFs and RCACs. And in a nutshell, these are assisted living facilities with a license to provide care beyond the typical scope of what an assisted living would do. For example, something like using a Hoyer lift. It's a machine that lifts a patient out of bed. Something like a two-person transfer, or doing things like wound care in-house, which would typically be sent out to a hospital. If they've got the registered nurses on staff that can manage the wound care in a CBRF, they're licensed to provide that level of care. Now, the more levels of care you're providing, the more regulation and oversight you'll see, which is why CBRFs and RCACs are classified in certain ways to describe what level of care they're authorized to provide, if that makes any sense. So for example, if let's say you've got a man named John Smith, John Smith, and he is in a nursing home, or excuse me, in an assisted living facility. John Smith needs help. John Smith needs help taking a shower twice a week and going to doctor's appointments. Now let's say John Smith does well for a while and then he has a fall. He breaks his hip, he goes into rehab, which we'll talk about in a minute, and goes home to his assisted living facility. but now he also needs help getting dressed because he doesn't have as much flexibility. Getting dressed is an ADL, not an IADL, so that's going to be more hands-on personal care. In an RCAC facility, they just bump John Smith up to a higher level. They'll probably use a charge in his rental or a price increase in his monthly fee to pay for that extra care service. And most of these communities actually run between $3,000 and $8,000 a month. That's a huge range, and that's just because, you know, in a nice area, they're going to be more expensive. In more of a rural setting or a country area, they're going to be less expensive. For example, here where I practice, there are assisted livings that run 10 grand a month. And there is an assisted living about 3 hours away that I helped a family move their loved one to that cost $3,000 a month. Both great facilities, both excellent level of care. It's kind of like the real estate game: location, location, location. But these assisted living facilities, they tend to feel a little bit less like a hospital and more like an apartment complex with hospital machines. And it's different from place to place. I've worked with RCACs that can provide a level of care that's almost as high as skilled nursing, which we'll talk about in a minute. So assisted livings, typically you do have to be a wise consumer too, but since they are somewhat regulated by Medicare, most assisted livings anyway receive Medicare dollars. You can go onto the Center for Medicare Services website and look at their survey ratings. Their surveys are the state auditors and surveyors who come in and evaluate the nursing home for cleanliness, health care, you know, are they billing things appropriately, kind of the whole gamut. They audit these facilities, and you can find their ratings and their deficiencies on the Center for Medicare Services. If any facility receives any Medicare dollars, they'll be on that website. So that's always a nice tool that I have when I help families find a place for their loved one to go. Now, according to the CDC, 2015, I believe, 14 or 15, the average American resident lives in an assisted living facility for about 2 years. Typically what happens after that is they either pass away or they move to skilled nursing because their needs of care exceed what an assisted living can provide. And a lot of times families say, well, how do I know if it's assisted living or skilled nursing? And, you know, depending on what's available in their area, depending on how their loved one is doing, the answer is always different. But one of the major differences I always point to is in assisted living, residents have to be able to ask for help if they need it. In skilled nursing, residents may not be able to ask for help and they'll still receive it. So for example, in a lot of skilled nursing requirements, don't allow people to lock their doors because they have to assume that people are not able to ask for help. Whereas in assisted living, the assumption is there that people have the ability to ask for help. Or things like a fire escape system. If a person can independently call for help or navigate a fire alarm in their room, then they're a candidate for assisted living. If they're not able to use an escape plan or call for help if there's a fire, typically they're going to have to be in skilled nursing, and that's a safety issue and a liability issue. But those are two of the main big things. Can a person ask for help if he or she needs it, and is a person safe if there were to be some sort of emergency? Can they handle themselves? So that kind of brings us into skilled nursing or nursing home. Skilled nursing facilities, they're pretty heavily stigmatized. In my entire career, I have met one person who was willing to go into a nursing home, and he only was willing to go after he laid on the ground for 2 days after a fall because he was terrified that he wasn't even healthy enough for assisted living, which with this particular gentleman, it wasn't the case. We were able to convince him to do assisted living, and he's much better off for it. Because in a skilled nursing facility, you're going to find a wide range. Sometimes you'll find people who are completely cognitively healthy and their bodies don't work anymore. You'll find people who have severe dementia. Their brains just don't function anymore, but their body works fairly well. You find the whole gamut. Sometimes you find people with mental illness, which is a big issue in the United States healthcare system. People with mental illness are often living in skilled nursing facilities long term because of their mental health. You find just all sorts of people with all sorts of health concerns. You find a lot of people who had a stroke and need round-the-clock care. So these skilled nursing facilities can vary widely. It's difficult to find socialization sometimes because people are all at different levels of functioning, both physically and mentally. And in skilled nursing facilities, they're very heavy regulated because they have to be equipped to care for people who can't advocate for themselves. So, for example, maybe a stroke victim who can't use language to communicate anymore, or a person with severe dementia. These are the types of folks where they can't ask for help. And some people in a skilled nursing facility can ask for help. I don't want to give the wrong impression, but skilled nursing facilities have to be able to help a person who literally cannot help themselves. So you see a lot of like Hoyer machines to help lift people. You see a lot of, bed baths, sponge baths, because people are not able to shower. But you also see a lot of positive things. Sometimes people are only in nursing homes temporarily. The care provided in nursing homes is excellent. I should say is supposed to be excellent. Now, most nursing homes are going to be divided into departments. So you'll have a dietary department, social services, activities, and all these departments meet quarterly or once every 3 months. Or if the resident has, maybe they go to the hospital or they get diagnosed with a new disease and they have care plan meetings. They carefully monitor each resident's progress. They look at their weight. They look at their intake of nutrition. Are they eating enough? Are they getting enough fluids? They go over their medications. They say, is this resident attending activities? Are they social when they choose to be? And one of the benefits of skilled nursing is that there is a team in place to look out for the resident. Now, in assisted living, they typically have something similar to a care plan. They're not always required to, depending on what level of care they're providing. But in skilled nursing, you always have care plans. You have people who are looking out for the residents 24/7, just a very high caliber of care. With that, there does come a very high caliber of cost. The national average price for a nursing home, a skilled nursing home, is $8,000 a month. I've seen some that are slightly lower than that. I've seen some that are private pay that are $16,000 a month. And that's a pretty high example, but it's out there. And a lot of people have the mistaken impression that Medicare will pay for a long-term nursing home stay. That's not actually the case. In cases of assisted living, typically Medicare does not pay at all. And you will find a lot of assisted living communities that ask for a certain amount of money up front, which is called private pay, and that's just out of a person's bank account. And then when that money runs out, the person will typically go on Medicaid or public assistance to pay for the cost of living there. Now, in skilled nursing, it's a little bit different. Medicare, and this will be fairly short, Medicare is divided into 4 parts: Medicare A, B, C, and D. Medicare Part D covers prescription medications. This is very simplified, very quick version here. Medicare Part C covers things like supplemental insurance plans, things like maybe dental plans or, extra health insurance policies. Medicare Part B covers Medicare Part B covers doctor's appointments, doctor's visits, regular checkups, regular upkeep and medical care. And Medicare Part A covers things like hospital admittance. If you think A, acute, you think A, hospital stays, and rehabilitation, which we'll talk about in a minute. Now, under Medicare Part A, if a person has been admitted to the hospital for a certain amount of time and they qualify, they can have a skilled nursing home stay of up to 3 months paid for under Medicare Part A. Now, that's where a lot of people get confused. The Medicare Part A only covers 90 days or 3 months of skilled nursing care. Beyond those 3 months, it's either going to be a private pay situation where the person has to use their savings or, sell their assets to pay for care, or it's going to be, if they don't have any money, they will go on Medicaid or a state program, and they'll go on what's called institutional Medicaid, which pays for their skilled nursing facility stay, pays for their care, and then provides them with $40 a month of personal income, which it is what it is. It's reality. I help a lot of people apply for Medicaid in my line of work because they've been in a care facility and spent down the assets. But the reality is, if you need care, you need care. And that can be that's tough. I mean, especially for these people who work a lifetime. And, it's not cheap. But there are certain ways to be wise about it. For example, a lot of people are choosing to move to what's called continuum of care facilities. These are communities that have an independent living, an assisted living, and a skilled nursing all on the same campus, so that if their needs change or if their need for care changes, they don't have to facilitate a big move. They can just move to another building on the same campus. A lot of the same staff, a lot of the same administrators and policies, just a different building, a different section of campus, if you will. And these are good. They're cost effective. They're a good option for people who maybe they have Alzheimer's or dementia, and they know that their need for care is going to increase in the future. Maybe they just want to move somewhere and not have to worry about moving again, or at least moving somewhere completely different again. All kinds of options within those continuum of care facilities. Now, two other things that I want to touch on. We've talked about independent, assisted, and skilled. Is two other things. One is going to be rehabilitation facilities. Rehabilitation facilities are typically attached to a skilled nursing unit or are on the same campus as a skilled nursing unit. And what rehab facilities are is they're a place for people to go and get stronger. Typically, they will receive one of three types of therapy. They can receive physical therapy to help strengthen muscles and increase flexibility. They can receive occupational therapy, which would basically be the ADLs and IADLs, activities of daily living, and independent activities of daily living. Occupational therapists test people's abilities to do things like do their laundry or cook a meal, and help them work on those tasks. And then you have speech therapy, which works extensively with speech and talking, obviously, but with things like swallowing. What texture of foods can people have? You see in nursing, especially in nursing homes, you see a lot of restrictions on the type of textures of foods people can have. And that's an evaluation done by a speech therapist. So in rehab, people are typically receiving 1 to 3 therapies, physical, occupational, or speech therapy. Typically, they're there after a stay in a hospital or an accident, for example, a fall. Pretty common pattern, actually, is a senior falls. They go to rehab to try to get stronger, figure out why they fell in the first place. Then they go either into an assisted living or a nursing home if they're not able to move back to their house safely. And so that's what a rehab does. Most rehab stays are going to be covered in full or in part by Medicare as long as they meet the specific requirements. And if a doctor writes an order and prescribes it, most people can receive rehabilitation in their home under their Medicare benefits. Usually it falls under Medicare Part A, but in some situations, therapy can be, and rehab can be considered a Medicare Part B. So it just kind of depends on the person's situation, their diagnosis, what their doctor says. And then the last thing I kind of want to go in the senior living thing is what's called inpatient hospice. And we'll talk a little bit more about hospice down the road, but hospice care is an approach to medical care for people who are terminally ill. So these are people who are diagnosed with an illness and they just due to the illness progression, they have 6 months or less to live. They're what's called terminal. And hospice care comes in to provide medical support and comfort care. So a person on hospice care can't receive treatments for their disease. They're not looking to get better. They're looking to manage symptoms and pain. And some people consider this to be giving up, but I don't really think that's the case with most people. It's just that they've got an illness that's not treatable or not curable, something like end-stage lung disease or end-stage kidney disease. And they just want to manage the pain and symptoms and pass away peacefully. And now some hospices have what's called an inpatient unit, usually in an assisted living or in a memory care, which memory care just refers to anywhere in usually skilled nursing or assisted living that's equipped to handle with Alzheimer's or dementia. And the inpatient hospice unit is just what it sounds like. Maybe it's a wing or a hallway of beds where people receiving hospice care go to live. And not everybody chooses to go to an inpatient hospice facility. People can receive hospice in their home, in the hospital, in the inpatient, wherever they choose to. But some people do prefer to go to the inpatient hospice facility. Some people don't prefer to pass away at home because maybe that's where they want their family to make good memories as opposed to bad. So that's an option people have when they're under hospice care. Now again, sometimes rehabs and hospices oftentimes rehabs especially, will be a part of that continuum of care facility. So to use an example here in Milwaukee, we've got one called the Lutheran Home. It's in a city called Wauwatosa, which is a suburb of Milwaukee. The Lutheran Home has a rehab program. They have an independent living wing. They have assisted living. They have a memory care hallway in their skilled nursing facility. They also have what's called an adult day center or adult day program. Some people refer to this as adult day care, but you'll find that in the industry it's falling out of favor because it kind of infantizes seniors to call it daycare. How would you feel if you were a 90-year-old World War II vet and somebody said, "Okay, Jim, let's go to daycare"? It's a word thing. It's a dignity thing. But these adult day centers are specifically designed to be places for people with memory loss. They do social activities, things like games, puzzles. They do crafts. They do baking, all kinds of things, just to keep people stimulated and engaged with memory loss. And like I said, the one in Wauwatosa, the Lutheran Home, it has an adult day program, rehab, skilled memory, all of that stuff, all on one campus. And that's a nice option for families to have. Now, they're not locked into that campus by any means. If they live at the Lutheran Home for 2 years and don't like their skilled nursing, they can go to a different facility. But it's a nice option to have, especially for people who don't like change or don't like big life transitions. So that's just kind of the down and dirty on these different types of facilities. There's all kinds of them in Lincoln. There's I think 2 or 3 skilled nursing facilities in Seward. I don't remember if they have assisted units or not, but if you're ever interested in volunteering or learning more, you know how to reach me, you know how to reach your local facilities. If you really want to get involved, talk to the activities coordinator. They're always looking for people to help with the activities. Especially with spring coming on, my guess is they're going to want a lot of help helping the residents garden. But anyway, so that's just the down and dirty of the places where seniors can go to live. Thank you, and we'll see you later in the week.